Welcome to the Support Report podcast, hosted by United Community Supports of Maryland. Here, we discuss any and all topics relating to adults with developmental disabilities as we strive to make support resources and other interesting topics more accessible to our community. On this episode of the Support Report, we will learn more about the Maryland Dental Action Coalition. Okay, so thank you so much for being here today. We have Mary Backley, who's the Chief Executive Officer of the Maryland Dental Action Coalition, otherwise known as MDAC. Mary, thank you for your time.
Well, thank you, Rebecca. It's really quite a pleasure and honor to be here. And I need to extend my appreciation to United Community Supports for the outstanding work that you do and how much you contribute to really serving the population in Maryland. So thank you very much. The Maryland Dental Action Coalition, also known as MDAC, MDAC, has been around really for over a decade, and our purpose really is to improve oral health equity within the state of Maryland. And we do that by working specifically with our very diverse constituency network of individuals and organizations, focusing on increased prevention, education, advocacy, and access to oral health care. Our beginning started with a very tragic situation in 2007, and it was following the death of a Prince George's boy, 12-year-old Prince George's boy, from an oral health infection that went to his brain. He was unable, his family were unable to access or get care for that. And by the time he went to the hospital, it was just too late. And it really was a wake-up call for the state of Maryland and the governor and the Secretary of Health in particular, of the terrible situation that low-income children faced in terms of trying to access dental care. And so Secretary of Health Combers formed what is our precursor, which is the Dental Action Committee, to come up with recommendations to ensure what happened to that poor 12-year-old boy and his family never happen again. And the committee came up with recommendations that really focused on provider participation, increasing that, statewide oral health literacy and education, informing families about the importance of oral health to overall health, increase in Medicaid reimbursement rates to incentivize providers to participate in the statewide Medicaid program, and other public health strategies to really elevate the access issue to oral health as well as the importance of oral health. And MDAC was really incorporated in 2010 to follow those recommendations and ensure they were implemented. And in fact, they were. We participated in a statewide education campaign called Healthy Teeth, Healthy Kids that really elevated and called attention to the importance of oral health care. And the providers signed up to participate in Maryland Healthy Smiles, and we're seeing children. It was such a success, it really elevated the state of Maryland to be a model, a national model, where the percentage of children now getting care through this coordinated and collaborative effort statewide really elevated the percentage of children getting care, where we exceeded Healthy People 2020. And in 2015, MDAC turned its attention and said, we did this for children. It's time we do this for adults. Low-income adults had not had access to dental care through Medicaid or Medicaid dental benefit since the 1990s, when it was cut due to the budget deficit that existed at the time. So we really turned our attention and focused on adults. And we have been, we had obviously a campaign that took incremental steps, calling the attention of oral health to overall health. And through our network, our very diverse network of regional, community, grassroots organizations that were extraordinarily helpful in terms of getting the word out educating their state legislators at the county and regional level, we took incremental steps in getting policy advances on this. For instance, in 2018, because of a report we put out on the use of emergency departments by adults for dental pain because they could not find a provider, um, there was a tremendous amount of money that was really paying for those emergency department visits that did not treat the issue. There are no dentists in emergency departments. It treated the symptom with pain relievers and referrals to providers that adults really could not access for a number of reasons. Couldn't get there, couldn't afford it, couldn't have coverage. So we really called attention to that, and we successfully recruited a number of oral health champions in Annapolis who were incredibly supportive of this. So we had a pilot program, and then we kept of that really provided care to dual eligible adults, those who are on Medicare and Medicaid. That started in 2018 and ran for about 3 or 4 years. Even during the pandemic, we were able to get adults to care who were eligible for care to care, and providers, at least 600 or 700 providers saw this population and provided the care, and it really showed legislators. It showed the outcome of getting care. Because of the correlation between oral health and chronic diseases, such as diabetes, we could show that there was improvement in diabetes management, improvement in terms of reducing prescription. The mouth is a part of the body. Oral health is a part of overall health. And we were able to show that. And in reports were coming out and correlating that. And as part of that campaign, we were able to extend recognition of the importance of oral health in prenatal and postpartum care. Gum disease has a tremendous impact on pregnancy. It could have an impact on preterm births. It could have an impact on low birth rates. So we also focused on the importance because of the statewide priority on maternal and child health. It was recognized by the governor, Governor Hogan, where he extended oral care postpartum for 12 months. So we took incremental steps. And then we got last session, after this concerted multi-year effort and the incredible work of our partners and individuals and grassroots communities throughout the state, we got legislation passed and signed by the governor on May 12th in 2022, establishing Maryland Medicaid Assistance Program dental coverage for adults. And what this is, it provides comprehensive care for adults. So that's diagnostic, preventive, restorative, periodontal care for adults, for 800,000 adults across the state of Maryland. Now is available starting January 1. So we are still in celebration mode, but now we're kind of in implementation mode as well, because this is the first time in 30 years that this comprehensive coverage has been available to adults. And as I said earlier, there is the correlation between oral health and chronic diseases, and a healthy mouth, good oral health, a healthy mouth is good overall. It's good for your body. It's good for your smile. It's good for your self-esteem, your mental health. It just is great for your confidence. It helps with concentration. With kids, it helps them concentrate in school and not having to deal with pain. Same for adults. It prevents lost days at work. It's a economic and societal benefit to an individual, as well as just overall benefit. So we are now working with our organizations and individuals within the network to get the word out, to encourage adults to to use this coverage that was given to them, and seek care, because it's so important for total health, overall health, mental health, all aspects of it. So it's a very exciting time, but there's a lot of work to do. But that's okay. That's okay. And
Yeah.
it's so encouraging.
That's really just incredible that you all were able to get that passed. I mean, what a true benefit to the state of Maryland and its residents.
Yes, it is. And again, it's a tremendous illustration of what can be done with organizations through collaborative, cooperative working together. Power is in numbers, and it's not necessarily power, it's the data to back it up. And we were able to accrue and get that data and have our representatives and partners really work with their legislator representatives and it's not a matter of convincing them because the data is there. And it's took tenacity, but the data backed us up. So I used to get calls all the time, Rebecca, in the office from adults seeking coverage because they were in such pain and wanted care, needed care that just and they couldn't afford it. Like many of us, it's
Yeah,
expensive unless you have coverage. It's
absolutely.
very, very expensive.
Very.
And it was just there are local health departments that have dental clinics that sometimes have reduced rates, fees on a sliding scale, which still are expensive. And it was difficult to say that, we're working on it. Care is not available, coverage is not available, but now it's really incredibly rewarding to get those calls still and say, well, we have coverage for you now. Coverage is now available, and we can direct you and hold your hand and take you along on how to find that, or work with a local agency on how to find that. We built a very simple landing page on our website, which is www.mdac.us, where it's click here to see if you're eligible. Click here to find a dentist. Click here to find out what coverage. State government sites, and this is not a criticism of them because they have to have so much information on there, understandable, but we just made it very quick, direct, to the point. Here's the information, here's the language, and of course our contact information is there, and we're available to help adults as well. But we are now reaching out to our care coordinators who are members and partners of MDAC, who really, like yourselves, who work to assist and support the adult community, to inform them of this, to provide you the necessary tools, information to show them how they can see if they're eligible, how to access care, where to click to find, and how to make an appointment. So we're only in the fourth week, but the reports I hear back are very good, particularly from community health centers who are seeing hundreds of adults. One community health center on the Eastern Shore, the dental director told me that one of their patients literally was in tears because she was not aware of the coverage, and the treatment plan that was required for several appointments would have been a tremendous amount of money, but because of this new coverage, it was something that she would be able to do with minimal out of pocket compared to what it would have been. So it's an extraordinary victory for many adults in Maryland, and we have the legislators in Annapolis and the governor to thank for this and moving it forward. So we're excited. Thank you for the opportunity to talk about it. It's something I raise my hands up about every day.
Yeah, absolutely. And we will definitely share all your information. The website, we'll have that linked and everything. Yeah, this is just truly incredible. And I know, again, finding a dentist can be something that's so difficult in this population, and especially finding one that will work with adults with developmental or intellectual disabilities. So, to be
It
able to,
then, yes. And when I talked about the pilot program before, that was for Medicare and Medicaid dual eligible adults. And many of those in the population had disabilities. And there was a stable of about 650, as I referenced earlier, 700 dentists who actively participated in that pilot program. And so when you find a dentist, normally on the directory, it will state who sees special needs patients or adults with disabilities. So I encourage you and your staff and your clients to look at that, also to ensure that you are going to the dentist that would be able to help you. But again, we're here to assist as much as we can. I think something that's also really important is the pilot program had an $800 cap, annual cap, meaning they could not get services and go over anything over $800 would not be covered. What's so phenomenal about this new coverage is that there's no cap. So
oh, wow.
there's unlimited amount of services in a year. There's no cap. They can go beyond 800. They can go beyond 1800. The the purpose obviously is to bring their mouth back to a healthy state. So again, I commend the legislators and the MDAC network for really working hard to get this accomplished.
Perfect. Well, Mary, thank you so much for all this information. This has been so helpful, and we can't wait to share it with everyone.
Absolutely. And again, thank you for the opportunity, and thank you all for your tremendous work.
Thanks again for listening to the Support Report podcast. Tune in next month for a new episode.